What's good, YouTube? It's Jay again, and I'd like to welcome you to my channel. If you're a respiratory therapy student or graduate seeking to take the TMC exam, well, you're in the right place. You may even be a nurse who just wants to learn a little bit more about this subject. However, this is respiratory therapy essential for the TMC exam. Now, tonight we're talking about ventilators alarm. Now, I know some platforms may tell you, to make sure that you study them and not really go over them with you, but ventilator alarm is on the exam and you have to know them. They are there to not only protect you, but they're there to protect the patient. So, without any further ado, let's do this. Okay, tonight we're talking about ventilator alarm, and they are very important for the TMC exam. You must know these in order to respond properly when an alarm goes off on the ventilator. Now on the board we have Roman number 1, 2, and 3, and I'll work from left to right in that order. On your high pressure alarm, first thing you need to know is that you need to set your high pressure alarm 10 to 15 centimeters of water above the baseline. The causes of high pressure alarm is one of the most important things for the exam. The causes are excess secretions, of course, suction your patient. A herniated ET tube, which can cause a lot of problems. And it's also called a high pressure alarm, and you must correct the ET tube problem. One of the most common things that you will find on the exam concerning the high pressure alarm is that the patient is coughing during inhalation. That is the most common thing that you will see on the exam. So make sure that you know that the patient coughing during inhalation will cause your high pressure alarm to go off. Decrease in lung compliance, very important. Anytime the lung compliance decreases, that alarm will go off and it needs correcting. A pneumothorax will cause a high pressure alarm to go off. If the ventilator circuit or ventilator tubing is kinked, and also excess water in the circuit, and I don't know if you've been around ICUs or ventilators. If not, you see this all the time, and a good respiratory therapy will keep that water out of the circuit. Now, some ventilator circuit has the HME right up by the patient. Why? And the HME will get clogged. If it does, no, you can't clean it out or anything like that. You just change it. Hopefully there's a humidifier system in place where you won't have to use that HME. And Roman on 2, our next biggest cause for a ventilator alarm to go off is low pressure alarm. You start off by setting your low pressure alarm 10 centimeters below the baseline, which won't hurt the patient. And if it goes off with this setting, then you know that there's a problem somewhere. So one of the problem causes for a low pressure alarm is patient disconnection. And remember, low now. If there's an underinflated or deflated ET tube, it will cause a low pressure alarm. You need to either put some air in or take some air out. A leaked pilot tube, ET tube come with this pilot tube. And if it ever begin to leak on you, then you just have to replace it. If the patient becomes disconnected from the ventilator circuit, you're going to get a low pressure alarm and you need to respond quickly. If your patient have a chest tube and suddenly there's a hole in the patient's lung, it will call a low pressure alarm. So whenever you see someone in the ICU, CCU, or step down, and if they have chest tube, you get a low pressure alarm, you need to make sure that you get on top of that and correct that problem. Now, a low flow to the system, is another cause of low pressure alarm. A leak in the ventilator circuit is the other reason for a low pressure alarm. And you don't want a leak in your ventilator circuit. And I want you to look over these. Again, I recommend that you don't take notes. I ask that you screenshot this or just listen to it occasionally, because I know that you are studying mechanical ventilation, patient assessment, hemodynamic, and there are a ton of things to study to prepare for this exam. But if you would just listen to me and play this video over and over and over again, along with your hardcore studying of mechanical ventilation for this exam, you'll be just fine. Okay, number 3, we have low volume alarm. Now this could be a patient disconnect. So you want to set the low volume alarm about 100 cc below your tidal volume. And if you do that, you won't have any problem. We also have a high-low oxygen alarm. Set your high, low oxygen alarm about 5% above or below the FiO2. Here is one that's on the exam that they will get you on every time, and that is your source gas alarm. Check all your connections. And if that doesn't work, then you need to check the bulk gas supply because you need that source gas going to the ventilator. Now, all of the ventilators have a battery backup, thank God, so that the patient will never be in danger, but make sure you check your source gas alarm as well. Low peak disconnect. These are the most sensitive alarms that's on the ventilator. Low peak disconnect, and make sure you study those, okay? They are very sensitive. If they go off, that means that there is a major problem somewhere. And the reason why we say that is because you have to monitor patients very closely that are paralyzed, especially when there's a low peak or disconnect. They're sensitive. And if the patient is paralyzed, then you must monitor these patients very, very closely. And at the bottom, can you see down there where I have power alarm? This is simply an electrical cord or a power supply failure. But God knows we shouldn't have these problems because, in the ICU, we have these red connectors where we connect ventilators to the red outlets on the wall because they are on a backup system where that power should never fail, however things happen. And if these things happen, at least you will be aware of them. Well, there you have it, people. These are 3 major concerns on the TMC exam that you will see again. And mostly when people miss the TMC exam by 1 or 2 points is because you've done a ton of studying in other areas. And you should make sure that you cover everything on this test. But in our platform, we just want to make sure that you don't forget the little thing, okay? Your high pressure alarm, you will see on the exam. Your low pressure alarms, you will see on the exam. Source gas alarm, you will see on the exam. And there you have it. Okay, people, I'm back. Well, there you have it, your ventilator's alarm. Please don't forget these for the TMC exam. You may not study them every day, maybe not every week, but make sure that you know your alarm before you attempt the TMC exam. Listen, hit that like button for me, subscribe to my channel, turn on the notification bell because I'm posting a video every week to help you pass the TMC exam on your very next attempt. And until next time,